everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
I think we've hit a plateau, but that's okay.
That's because
we need to because we hit our big goal
because we're ready for production of our.
And we finally figured out our scheduling with it.
Yes,
kind of.
Yeah,
for the most part.
I mean, how it's going to work.
Yes,
sooner
it's
than
going to
later.
happen.
Yeah.
Yep.
Yeah.
So that's good.
We just need to pick dates.
Yep.
Yeah.
Oh my goodness. So what? We're at 259. Previously 257
on Spotify.
Yep.
Okay.
106
on Apple.
Okay, that's still pretty cool though. I mean, I can't believe
they're
that.
still growing.
I can't believe like all of that on Spotify.
Or they actually leave reviews. They're watching us, and they actually leave reviews on us.
Yeah, it's very
like people are
humbling.
talking, like just strangers.
It's very humbling.
Weird.
It's
I wonder
very
if they're all
cool.
nice. I feel like
I wonder. Oh,
Devin, I love your hat.
Thank you.
It's awesome.
Cap? Even if they're mean, I guess they're still
Cap?
cap.
Okay, wait.
It's
That's a
scrub
good question.
cap.
Would you call that a cap or a hat?
A cap. A bouffant. Is that what they're called?
A bouffant.
Just
It's a scrub cap.
A surgery cap. Surgery hat.
I typed in scrub cap.
Something that's worn on the head by definition is a hat.
Cap. No. I think it depends on what it is. If it's a cowboy hat, it's a hat. I don't think it's not just like a generalized thing. If you're at a rodeo, you're gonna be like, I like your cap.
I like your cap.
You get kicked out so fast.
Context. Context matters.
Okay. I wonder what the definition for cap and hat are. I don't know.
We'll find out.
TBD.
Okay. Stay tuned for our next episode.
Stay tuned.
Okay, new review. I just discovered this podcast. I love how upbeat everyone is. I've been in the field for 12 years and still love learning new things. Thanks for sharing interesting cases with us. At Def Vet Tech.
Cool.
Thanks.
Thank you for the review.
Yeah.
We just said,
That's
that's
awesome.
pretty awesome that people
Isn't
leave
it
reviews.
cool how like
12 years.
I was going to say 12 years and there's still interesting new things to learn.
It's
and
medicine.
Oh my gosh.
Medicine's
yeah, there's always something.
evolving.
It's always something.
It's crazy.
Yeah.
Kind of scary.
This is scary. Because you never get to the end of the road.
I know.
Like it's just
like
a perpetual learning adventure, basically. Like you never feel like.
Even the diseases, we got a diabetic dog. I mean, diabetes, you diagnose it and you treat it and you manage it, right?
Diabetes.
Well, you got this dog that's just not behaving as it should.
You didn't read the textbook.
Never had this issue before, and so now I got to
And we have a lot of, and that's saying a lot because we have a lot of diabetic patients.
You guys do.
Duck and I are the diabetic team.
Yeah.
We have a lot.
The internist. Probably going to refer.
I had to pull in the big guns. Wow.
I know.
Yeah.
Okay.
I remember when you first started working and you were like, will I ever feel like I'll have it mastered? I was like, never. Even at my age, I don't even feel that way. Like, so hate to break it to you,
but negative.
So all those newbies out there.
You just get more comfortable, I think, with the uncomfortableness.
Yeah.
Like over time, you just like.
Or not knowing.
Yes. You get more comfortable with not knowing.
Be comfortable being uncomfortable.
Exactly. Yeah. Absolutely.
She does it probably once a week.
Yep.
Yeah, exactly. I'm Dr. Emily King.
I'm Courtney Allen. I'm Devin Fortune.
I'm Dr. Ashlyn Duckwall.
And this is the Veterinary Roundtable.
BRT.
Shout out. Harrison said that we reached 10K on Instagram.
Oh.
10,000 followers. So thank you guys. Thanks for that 10,000th person. Were you here?
I was probably stretching my back and not paying attention.
She was doing the cow dog or a cow cat.
I randomly got a knot in my back before we started, so I just stretched it out.
Got it.
Pretty cool. 10,000 followers.
That's awesome.
Cool.
That's
on
amazing.
our social media channels at the Veterinary Roundtable. So if you're not one of those 10,000 people, check it out.
Yeah.
Check it out.
All righty.
We're on to Pits and Peaks.
Pits and Peaks.
Wow, we got there quick, I feel like.
We sure did.
Yeah.
Not too bad.
Okay.
Who's going first?
Okay, sure. I have so many. I have a lot this week.
You got to save
pick
a lot.
No, I know. I'll pick one. My peak is that I get to pick up my husband from the airport tonight.
Excellent.
He's been in Florida for the past few days, so I get to see him tonight. So I'm very excited. My pit is that I injured my back really bad. Which I mean, if you're in this field, you have a lot of issues with your body in general. But I don't know what I did. I'm making a doctor's appointment. But it hurts. It's very debilitating when you have a physically taxing job. I feel like I can't do my job to the best of my abilities recently, which sucks.
Did you say you've made the doctor appointment or you're
I'm
making
making it today. Yeah, I have to call when we're done filming. But it sucks. It hurts.
Lift with your legs, not your back.
Yeah, I'm trying to self-diagnose, but
I know, right?
Probably
If
because I
you-
was like, she walked
If
up
you
to me
feel like
yesterday.
this, and this, then what is it?
Because like my massage therapist was like, well, I got a massage therapist, but she's like, you may have torn a muscle, and then
She came around the corner at work yesterday and she's like lingering, and I knew she was gonna say something. She's like, "Have you ever injured your rotator cuff?" And I'm like, "No."
That's your arm,
That's
though.
in your shoulder, like in the shoulder.
Is that what hurts? Where is
like it's like shoulder blade, but then like it's when I'm doing certain things, like I can't push up on stuff with this arm.
You
And
do
it
have
shoots down my arm.
You have
tunnel?
bursitis. You could have bursitis. There's
Yeah.
a bursa in the back, like that lives between your shoulder.
I don't
blade
know,
and
but
the-
it's
taking them
like
NSAIDs?
because I've had plenty
Yeah.
of pinched nerves, and it is not a pinched
come here.
nerve.
Let me press.
Soft tissue injury. She's gonna go.
It hurts so bad.
Bite.
It's just I can't do anything with my right arm, and it's my dominant arm.
Well, we know you're not resting.
Pain
Are
is
you
palpable.
taking NSAIDs?
It's
Are
not doing
you
anything.
Icing?
I mean, pain
I ice and I
elicited, right?
heat and I
What?
stretch.
Pain elicited on palpation.
On palpation.
Talking, say it in COVID.
That's right. Exactly.
But yeah, that's it. That's all I got.
Devin, what about
Okay.
you?
I'm gonna have 2 peaks this week.
Ooh, I
I've
like
never
it.
done that. First one, guys, I'm so freaking smart because my sister surprised me.
Oh, you are
I
smart.
know.
You knew it. You called it.
I was 50-50. Like, I was in my head and I didn't want to, like, get my hopes up and then get crushed. But she surprised me and they pulled it off so well because it was like I went out the night before and then the next morning we were like getting ready for a winery and my mom like went to get a gift for my room and then out walked my sister and it was crazy. We were bawling. It was really sweet.
Oh.
But I'm really glad that happened.
Yeah.
And I posted it on my Instagram. And one of our listeners who follows my Instagram slid up and was like, I was manifesting this for you. I'm so happy for you. And it was really sweet.
That's really sweet.
So thank you, Harley, for manifesting that.
Yeah, put
because
that
I
stuff
needed
out
that.
there, man. You got to put it out
It
there.
was
for it to
literally my
happen.
biggest birthday wish, and it came true.
That's
So she
very
was
cool.
here for
Awesome.
24 hours. And then my second peak that I somehow have not talked about yet, I suppressed it. I'm going on vacation. I leave on Thursday. Today's Tuesday. So I'm leaving in 2 days. And my mom and I are going on a road trip out west. So we're flying into Colorado and then driving through Utah, Nevada, Idaho, Wyoming, Montana, and flying back.
That's so
It's for like a week, and I'm so stoked.
Wow, that's
Yeah.
really
Exciting.
cool.
I know.
Are you going like national parks or just
Oh yeah,
drive?
we're
okay.
doing 8, I think. We're doing Arches, Canyonlands, Capitol Reef, Bryce, Great Basin, Tetons, Yellowstone, Glacier.
Oh my
Jeez, wow.
gosh.
That's
so
amazing.
exciting.
Checking off my list.
Yeah.
Are you camping or
No,
hoteling?
hotels.
Yeah.
Yeah.
That's
my
really
gosh.
cool.
I'm so really
That's gonna be
excited.
so
I can't wait to see the
cool.
pictures.
Yes.
And this time of year, I feel like is perfect.
Oh, yeah.
Yeah.
So
Oh
It's
my
like
gosh, it's going to be
60s.
beautiful.
Yeah.
Yeah.
Mm.
Perfect hiking weather.
That's so cool.
Mhm.
Very cool.
Yes.
Wow.
We should totally go do that hike that you do at the Grand Canyon where you walk the whole thing, the bowl or whatever.
And do a show the entire time.
Like you walk
That
like
sounds
I
like
wonder
a
how
lot of
long
work.
I think
it
it's
is.
I feel like it's like 2 days or 3 days. It's not like a week or something.
that'd be
Let's
fun.
do it on horseback.
Of
but
walking?
you do something where you walk the
My
Are you
hips
insane?
start hurting
Girl,
after
you
a
can do it.
mile.
We'll get you in shape.
My arthritis flares. Ask
I have to
Pulse.
wear my
Okay, we'll put you on a
I can't-
donkey.
I was gonna say I can't walk that much.
Don't joke.
We're gonna have to, or like one of those things
no,
where you pull
we
her
can ride
behind
a
us.
horse.
Okay,
If you don't use it, you lose it. You got to be stronger.
You gotta ask Faust and Pulse. We've gone on
I have
walks
bad
that
knees.
are a mile or longer, and towards the end, there was one time Pulse and I were walking around Carmel, and I was like, "Are we close to home? My hips hurt so bad."
Oh,
my
you have to
gosh.
strengthen
I've got
them.
arthritis. I got RA, rheumatoid arthritis. They hurt.
oh my.
So no, I ain't doing 2.
We are
3
gonna
mi-
have to
or
put her
2,
on
3
something
days.
We'll get her a wagon.
We'll get her a
Take
wagon.
turns.
I'll pull you on
Yes.
my horse.
Let's do it. Let's see. My
You have a
peak.
pit?
Oh no, she
No,
did
she's
2
2
peaks
peaks.
this week.
Oh, so you, okay.
I'm a little hungover
I
still
like it.
from Saturday night.
My peak is Covet because I feel like it was in my peak and pit. Because change is my pit, which is always hard to do, and it's hard to implement change, and it's hard to feel like when you're the one implementing change that it's going to go okay, like it's going to
Mhm.
be successful, or what have I just done? You know, all those feelings, you know, and but it's turning out okay. People are doing it okay. They're catching on okay. I think it's a great thing for us to be using. And I think it's going to, when I saw Jones, how happy she was, like I went around the corner and asked her and I was like, do you like Covet? You know, how we've just implemented. What are you thinking? And she was like, oh my gosh. But she didn't know she was on video. So she was like genuine with her response. She was standing at the computer and she's like, oh my God, it was amazing. And then she turned around and she started laughing because she was like, oh,
yeah,
wait,
and
I'm
she
on
was
camera.
not excited about it. So that says a lot.
Yeah. And I think like, wow, she went from like having 50 notes at the end of the day. That's an exaggeration. But like 25
No, I would say like 15.
left. I'd say it's more than that.
She'd probably have between like 15 and 20.
Since I was the one auditing her, I would say it was like, yeah, maybe 15 or 20 on some
Not
days.
50.
We'll say 15 then. By Monday, come Monday, if they weren't completed, but there was times where they were.
Yeah, now she has like 1 or 2.
Yeah.
That's pretty
That's
cool.
pretty good.
And like she doesn't have that stress hanging
How are-
over her.
Yeah.
Her assistants and her team don't have the stress hanging over them that, you know, we've left
Get it
these
done.
things
Yeah.
undone. Like I'm just like, okay, it was worth it.
Yeah.
It was worth it to move the cheese.
Is that a
Mhm.
saying?
It's
Okay.
a book.
It's
Who Moved
Courtney
My
knows.
Cheese.
Wait, you were, I guess it was a while ago.
Yeah.
You read that book.
Yeah.
What?
Will Clinic read a book called Who Moved
Who
My
Moved My-
Cheese?
Who
No, the
Moved
only
My
one I
Cheese?
read was like the Jordan Belfort one.
It's about
Oh.
change. Who Moved My Cheese is about change.
It's a short, easy read.
It's
Yeah.
a
You should
really,
read it.
it's a really good book.
Yeah, it's about
It's,
change.
you know, on your
and-
vacation.
Yes.
Oh, that's how I want to spend my time.
It's a good book.
It's fun.
I hate reading.
Oh my gosh.
That blows
Okay,
my
I'm going to give
mind.
it to you on Audible and you can listen to it.
There you go.
I love.
As your white
reading.
Can that
walking
be
through
after I graduate
Yellowstone.
school?
Sure.
Okay,
Oh, because
great.
you got enough other stuff you're
Yeah,
reading.
I'm reading my
But
anesthesia
this literally
right
would
now.
be a 2-hour Audible book. And
If
you would
I
listen
could
to it.
read it in
Plain.
2 hours.
Yeah, you could read the whole thing in 2 hours. Like
You guys
it's not.
clearly don't know me.
It's a story about mice.
In
Anyway.
their cheese.
And their
Shocker.
cheese.
And who moved it?
So yeah, that's what I got for you this week.
Okay.
My peak is I got my hair cut. My pit is that I hate it.
I was wondering how
liked it.
quickly that would
You
Again.
came in the other day and I was like, I said even said something to you. You look so good.
Oh, thanks. Well, it's up in a pony, a small pony.
Schmall.
And it will be there for a while until it grows a little longer. But the other peak is that I'm going to donate what I cut to, I haven't found a specific one yet, but basically whoever makes wigs for cancer patients.
I did Locks of Love.
Oh, okay.
Yeah, I did
That's
that
who I
too.
donated my hair to.
That's who I, yeah.
And they sent me a little card thanking me.
That's really cool.
So.
Yeah, that's awesome.
There's a rainbow at the end of the storm. Hair
There you
grows
go.
back.
That's right.
It
exactly.
does. It does.
Where
All
are
right,
we?
on to the trending topics. Right?
Yep.
Okay.
Yeah.
It's the Colorado legislator believes vet techs, not mid-level practitioners, are the solution to workforce issues.
Yes.
Yes.
Take it
So I
away.
know we talked about this trending topic and like our thoughts on it, but this lady did a wonderful, she's a veterinarian, did a wonderful job at breaking up like why it's not going to be the answer
Solution.
to all the
Mhm.
problems and how it's really not set up well education wise for these people. Well, yeah.
Yes.
So I think it's a very well written, practical way
Yes.
to list out the reasons, as opposed to like, I'm sure people are like, oh, you guys are just emotional because it takes away your job and money and blah, blah, blah. But no, there's like legitimate concerns surrounding
Yes.
this position.
Mhm.
And so I would highly recommend reading this.
Yeah.
It's very short Q&A and she
Mhm.
lays out great answers.
Mhm.
And if anybody was like me, I was under the assumption that these mid-level practitioners were going to be RVTs, and that's not what the Colorado bill says.
Right.
So, like, it says that you have just a layperson who's going to go get a master's degree and then essentially be a veterinarian.
Yes.
Yeah.
And so I think that's where we have the problem because of the
With the
so many
veterinarian still
issues
babysitting them.
with the veterinarian still babysitting them.
Yes.
Like, why not leverage? And I think that's what this veterinarian is saying. Why not
Yes.
leverage the technicians and allow them to grow? Like,
Mhm.
that's what I see happening. Like, that to me is the mid-level
Yes.
position. Is the technicians growing into that mid-level position?
Agreed.
I guess I also was trying to figure out what the difference between I forget what the VPA, veterinary professional associate, and an actual veterinarian would be, like skill wise.
Exactly.
Like
There
they can
isn't.
prescribe.
Well, they would. I think they,
they
were
can
going to
perform surgery.
I
they
think
can
it's limited
diagnose.
surgeries. I think it was just like electives.
Oh, like
and
space
some
Well, also
neuters.
says I think it's still that veterinarians with a license can only prescribe even on or off label.
Yeah.
So
Oh, that's true.
you still,
But still, that's
I
so
s-
similar.
Well, and just think of
But
all
then
all the law
concerns.
stuff that would
Yeah.
have to be changed. Like,
And then the article also says
Yeah.
like the biggest board complaints that will get presented for veterinarians are surgery and communication. Well, how are you going to let these people do surgery when they don't have any training?
Yeah.
And then ultimately, I think her really good point was ultimately who suffers is the animal and the patient that is financially
Yes.
responsible for
Yes.
that animal.
Mhm.
Like,
Yeah.
And then they're saying it's going to solve the shortage of veterinarians. And it's like,
no, it's
we
not.
have a shortage of vet techs. What are you talking about?
That's
Like,
why I think it
yeah.
should be technicians. Like, that should be a
Yes.
position that technicians grow into.
Yep.
Like,
It's just a
additional
really bad
schooling, and then
idea.
boom, you have these people who now have had the base knowledge,
Mhm.
and now they continue to acquire knowledge.
Yeah,
Mhm.
that
You
makes
know what I mean?
sense.
Like,
yeah.
I'm like, that would be so exciting for people. Anyway,
I don't
Mhm.
know. I don't know who started this. But
I was going to say clearly not
Right.
wait, we do know who started it, but I can't think off the top of my head. And it doesn't make sense. The people that started it,
Yeah, were
Or
they
not
like,
in
were they
vet
like a
med?
vet tech or
oh, I can't remember. I feel like it was somebody who was definitely just trying to solve the shortage of veterinarians. So it wasn't a veterinarian. I feel
Which
like
it
it was
even says the percentage of how there's going to be an increase because of the new vet schools that are.
yeah,
Mhm.
It's
13
just like
new
they're-
schools.
What shortage are you talking about? In the rural areas where they don't get paid? Yeah, fix that issue. I'm hot.
You're hot.
I'm hot. About
You know
this
what I would
topic.
tell you how to fix that issue in the rural areas is, and I know they have some programs, and I don't know the specifics behind them, but like just pay these people to go to school,
Yeah.
to go to the rural
Pay
area.
for their school.
And you have to stay there for however many years, 5 years,
Sure.
because probably by then you'd like it.
Well, it's just like if you
And you would stay.
Yeah.
You know what I mean? Like,
Yeah.
like it becomes your home, right? So then you're no longer a fish out of water. So
Yep.
like you actually have attachments in
Mhm.
the area, and you would
Mhm.
value the people. So you probably would stay.
Yeah.
Yeah.
So why not do more of that?
Why not? You know, that's such a simple question.
Like, and I think
Why
you
not
do it.
do
Like,
that?
yeah, why not? I because we're not in charge.
It's not a good idea.
It's just
You
the
know, some of the
incongruity
safety
between
hazards.
the cost to go to school and the pay when you get out. If those two weren't so in a rural setting,
Yes.
if those two weren't so mismatched,
Mhm.
you could do that. You would do it. You would have people going like, I could do that.
Yeah.
You can't. Like, you legitimately cannot. We broke down all the costs. There's no way for someone to go support themselves
Right.
and pay back their loan.
Yep.
And just like the fact that it can be a random person off the street to go get this position or go to school for this position
Scary.
just blows my mind. Because
Yeah, there
like
should be some
you said, I would
prereqs.
get the whole like moving an RVT into that position because shoot, I've been at the clinic for 7 years. I can do like if she couldn't do a coughing patient, I'd be like, okay, hearts sound good, blah blah blah. Here's some doxing cough tabs, send them on their way. Like that would make sense because I have the experience and I've
Right.
seen it so many times. But like a random person that can
Right.
just
Yeah, it's
that hasn't
mind-boggling.
worked in
Why
vet
on earth
med
would you
or,
not?
like
And the only thing I can think of is because there's not very many RVTs. So like it doesn't
Yeah.
allow you to solve if you're
because then
trying
you're
to
missing that person.
if you're trying to
losing one
solve
person.
the people problem, then you're just robbing Peter to pay Paul.
yeah.
And you don't even have that many Peters to
Yeah.
pay Paul. Like
Yeah.
you got 10 Peters, you need 100 of them.
I know.
You know what I'm saying?
Yeah, you need a lot more Peters.
You need way more Peters. That's all I'm saying.
You have a
All
lot
right.
of sayings up your
Listen,
sleeve.
Yeah, she does.
listener inquiries. Have you guys ever heard of the senator from Alabama and all the things that he says, like
No.
his funny sayings?
No.
Oh my God, he's amazing.
Give us one of them.
I can't because they're so good. Like you're, this is more. He talks like this. This is more serious than 5 heart attacks. Like he'll say stuff like that. It's like so funny because he just has so many good. Robert Kennedy, I think, is his name. Harrison, is that his name?
Like
Look him up.
the,
He's an older gentleman from
as in like
Alabama, maybe. I don't know. I'm totally saying the wrong state.
like descendant of JFK?
No,
Oh,
no,
not
no.
that one.
He's a different guy. Totally not even part of that family. But he always has these quips, and he'll be like, it's harder than a. I don't know. But it's so great. You're listening to him, and it just doesn't go with what he's talking about because he's talking about things, but then you laugh, serious things, but then
Yeah.
you're laughing. Anyway, okay, sorry.
I love the sayings that like people out in Europe or like with English accents will say.
Yes.
You know what?
So cheeky.
Yes, so
Or-
cheeky.
I don't know, just little stuff like that.
This is kind of off topic, shocker, but you know the saying when life gives you lemons?
Yes.
Apparently, lemons weren't even a real fruit. They were made from bitter oranges and citrons. So
Okay.
the comments were like, why does the saying go when life gives you lemons? Because life doesn't give you lemons.
Oh, you mean because we never had lemons like
yeah,
that? Like,
lemons are
we-
fake.
man
Yes.
created the lemon. which also,
we
I
bred
mean, that
them.
makes sense, kind of, sort of.
We bred them.
and made a new fruit.
Just like doodles.
So just, I learned that the other day and I thought it was fascinating.
Yeah, that
Lemons
is
aren't
very,
real.
actually very
just
fascinating.
like doodles.
Oh, I think you said zoodles. Like
Oh, do not
zucchini
bring up
doodle.
doodles. We'll get in trouble. Okay.
No.
Let's go on to listener inquiries.
Okay. I'm a surgeon at a high-quality, low-cost spay-neuter clinic and do 50 to 60 surgeries a day and listen to podcasts during surgery. Do y'all have any recommendations for veterinary-related podcasts? What are some of your favorites? Thanks. From Dr. Glen Campbell.
That just blew my 50 to 60
Yeah. They go,
But-
My hands would be so tired.
I know.
God bless
The
America.
Vert.
The
us?
Vert?
To
Well,
Vert.
clearly he listens to the
pod.
Vert.
I know.
That's
Just
insane.
us.
It's just us.
What's Crocker's called?
Oh, yeah. Questions with Crocker.
Mm-hmm.
And then
The Derm. The
Derm.
Harrison, what's
Yes, I saw her. She's
Bourgeois' name of her podcast?
What about
The Derm Vet.
The Derm Vet podcast. I mean, she does, because she's derm, you learn a lot of stuff.
and then you're a vet. Now what?
You're a vet, now what?
Dr. Macaulay?
And Dr. McCauley.
Also, a non-veterinary related podcast I think that is absolutely worth listening is the Craig Rochelle Leadership Podcast, because it's bite-sized pieces of information that allow you to learn concepts that are easily then relatable to your field. And I think that he does a great job of giving you big chunks that you can, and it's not like you have to listen for 3 hours. Like, it's 25 minutes.
Mhm.
Oh, that's nice.
So I really,
I'm-
really, really
I'm
like
not
that.
a podcast listener.
Me
I know.
neither.
Well, if you had to stand for 10 hours, you might be.
Yeah.
You know what I'm saying? Like, I could see why.
Jake
It's either that or music.
Doing the
I mean,
same thing,
I
that's
listen.
routine.
Yeah, I listen to podcasts like on like 12-hour drives to South Carolina, but that's
Yeah.
Jacob's thing. But
Yeah.
So there's some.
yeah, there's some. Absolutely.
check them out.
Check them out. Check them out. I
Next-
would say also Dr.
Oh.
Rourke's podcast is decent.
Who's
Andy
that?
Rourke. He's a guy that's been on the scene, like from a social media podcast kind of scenario for a while. Really funny guy. You guys would know him if you saw him.
probably.
If you saw his stuff, you would think, oh, that's who that is. But he has good guests on. He usually does guest episodes, and his guests have relevant information as it pertains to veterinary topics.
Gotcha.
So he would also be good.
I would say I would check it out, but I probably won't.
No, you won't. No, you won't. That's right.
Okay.
Okay, next one. Hey, VRT, just listening to old episodes and heard you mention Australia. You might not know this, but you have a fan base here.
What?
That's
so
cool.
That's crazy.
We're going to Australia.
I know. Watch out for the big spiders.
Yes.
That's the reason I wouldn't go.
Yeah. I'm a vet student at the University of Sydney, and I love your pod and listen to you every week. You're all welcome to trek out here and come speak to our class whenever you want. Here's an icebreaker if you haven't done already. What's your dream travel destination from
Bora Bora.
Sydney?
We have to go to Australia.
Oh my gosh, we have an open
do you
invitation.
think that's from Sydney or it's from Sydney, Australia?
Maybe
No,
both.
Maybe both.
Well, she
Is her name Sydney?
Her name is Sydney, and she goes to the University of Sydney,
And she lives in Sydney, Australia.
Well, I'm assuming the University of Sydney is in Sydney.
This is good.
I think we should totally go.
Let's
Oh
do
my
it.
gosh, I can't
Can we
even
plan this one a
imagine
little
that
bit
plane
better?
ride.
That plane ride would be so long.
I can't imagine it being. We'll probably go the other way,
It's like
like west.
It's a long
15 million hours.
Yes.
How
Let's
long
look
is
it
it
up.
actually?
Like a
Okay,
over a
Devin's
day.
looking it
It's
up.
over a day.
I'm gonna do American.
Okay, listen, Sydney, we're actually considering this.
Also, if we go, you can't just go for 2 days. You have to go for like 2 weeks
We probably
because
have
you're
to
going
fly to like
all the way
JFK or something
across the
first.
world.
We have to make
Right.
it worth our trip.
Okay.
I don't know what an airport in Australia.
I
is called.
think we definitely do this. I think it needs to be one of our goals.
Okay, who's going to fund it?
Okay, well, I mean, I think we do it like for one of our goals. Like
Everybody
we
sponsor
get
us.
to 500 reviews.
Okay.
Maybe it's episode 500. I don't know. I don't know what episode
We're
on
almost
right
on
now.
episode 100.
So like
We
Okay,
have
so we got
400
time
to
to
go.
save.
we got
money.
time to save money.
Yeah,
and
yeah,
then
yeah, yeah.
we go. Although if that takes us 5 years, she wouldn't be in school anymore. We need to know what year she's in school.
Yeah, we need to know. We need to
So
know
we
the
get
details.
there by the time.
Let us know when you graduate.
So yeah,
This is so cool.
yeah, that somebody that
But if we
there's a
went to
fan base in
Australia-
Sydney, Australia.
Yeah.
I'm really
I
scared
had
of the
someone
spiders
comment that
though.
on my Facebook post.
Let's go
I
to a
posted.
conference
I don't think
in
that's the right
Australia,
airport.
and
Okay.
then we could.
Go
Go
talk to
there.
this class.
Yeah.
And then go see things.
Yep.
In Australia.
Did you figure out how much it's going to cost us to go?
Well, she
No,
was
I
looking
can't.
at the
I can't find the airport.
Oh.
One
Just-
moment.
Can you just
Okay.
look it up on Google?
I am now.
She'll get back to us on
Yeah.
that. Okay, what's everybody's destination of choice?
21 hours.
What?
That's not a day.
On one plane or total?
Total.
So we would get to
it's-
break it up. a
Well,
little bit.
yeah, but that kind of makes it worse because then it's longer.
Oh my God, you
with
guys, that's an
layovers.
entire day of
On a
traveling.
plane.
I would feel
but I wonder what the time
over the
changes.
ocean.
There's
Okay, it's okay, Duckball. We can do it. We'll just drink
We can
some on the plane.
Okay.
I wonder
like
if
the
we'll
bridesmaids.
drug you and knock
In the-
you
in
out.
the-
like maybe by
movie.
the time we get there, like they're yesterday or
Yeah.
something.
No, they're a day ahead. So
Oh.
we would lose a day.
Oh my god!
It's like as if we didn't live a day.
Yeah. That's
Wow.
We time traveled.
We'd
Okay.
also have to.
We could time travel
sleep
back,
for
but
a
we got to
day.
leave the same day twice
Oh
on the
my
way
gosh!
back.
Wow.
We would be time travelers.
We could make different choices.
Is this how people always feel when they go to
We
and
can
from
redo
Australia?
our
Yes.
day.
Okay.
We would have to we'd have to figure out, our bodies have to figure it out, so we lose a day by getting there.
Talk about
so
jet
that's only the
lag.
first week, so we have to save for 3 weeks.
Oh my gosh.
That was
Then we
girl
get
math
used
or
to it being
something.
there, and then we'll be really bad when we come back. All right, Cindy, we're going to get back to you on this because
Okay.
this is something that we're going to do. But we got to go destinations of. You said Bora Bora.
Bora Bora. I was overwhelmed because I literally want to go so many places.
Yeah.
But if I had to decide, I would probably say you're gonna kill me: Antarctica or Alaska.
Ooh.
I don't think Alaska's bad. I'm not sure about Antarctica.
My cousin lives in Alaska, and it's
Dark.
beautiful.
Dark.
Beautiful.
It's
Could be
dark,
dark
all the
a lot
time.
of
I think it depends. Like, I see myself going to Alaska in the upcoming years, but if I had all the money in the world, I'd go to Antarctica.
Why?
Just to see it. It's like so otherworldly. I feel like
Yeah.
no one goes to Antarctica. I mean, surely people do, but not that many people. And you have to I know someone that just went there and they had to cruise to Antarctica.
Wow. That's cool.
Like they flew to the tip of South America and then cruise the rest of the way there. And there's only their airport there it's not a runway. It's just like a sheet of ice.
That's terrible.
It's not a runway. It's a sheet
that
of
sounds
ice.
like bro science, but we'll
Literally.
go with it. A sheet of ice.
I think it'd be so cool.
I think that's cool. I don't know if I would rather go warm than cold.
I like the cold weather.
You like cold?
Mm-hmm.
Yeah, I'm with Courtney. I want to go warm.
I've always
Where'd you
wanted
say?
to go to Bora Bora.
Honestly, truly, I want to go to Scotland so bad.
Oh,
Scotland is really your thing.
For
We'll
right
make a trip
now-
there too. We'll make a trip there.
Like
for you.
that's my next dream travel destination. Because Devin, I'd love to go to a whole bunch of different places, but realistically,
Mhm.
right now, my present day life, Scotland is my next focus.
I want to go to the place where they have the huts that are over the water.
That's Bora Bora.
Is it
Yeah,
Bora Bora?
it
Is
is
that
Bora Bora.
like the Pacific
Yeah.
area?
They have
It's like
it's
a
I'm
like a
too
walk-
afraid of tsunamis.
It's
I
like
don't
a-
know if I
it's
can
like
make
a-
myself go.
It's like a walkway, a boardwalk, and
Yeah.
then little huts. That's Bora Bora.
Okay.
It's like-
yep.
We want to go together.
Okay.
It's like Hawaii area.
Yeah, okay.
Yeah.
As long as I could get a warning about a
I just
tsunami and then
want-
run to
because,
the mountain
like,
and
in
have
those-
enough time.
In those huts,
And then there's a volcano.
Oh,
You don't hear
eruption.
about tsunamis there. I feel like
no.
There's no
tend to
tsunamis?
be-
You know why I want to go? Because in the little huts, the bottom, some of the
Yes.
floor is glass,
Yeah.
and so when you're taking a poop in the morning, you can watch fish go by.
Oh. No, that
Okay.
gives me the goosebumps. What if a shark comes up and eats your butt?
Oh my god, a shark
hole in the
eats your
floor.
butt.
There's not a hole.
we know where Duck
There's
not
just
going.
glass floor. No.
Okay,
break the
on to the
glass.
next
You have a
one.
valid point.
Okay.
Ew.
Okay, next one.
Where are we at?
Hey TVRT. It's T-Vert.
I love it.
Hey T-Vert. Love your show and have loved learning so many new things from listening to your podcast. My first question is an opener for y'all. What is your favorite hack or tip around the vet clinic that makes your day run smoother or just easier overall? Organization, products, tools, methods, etc. My second main question is, what are your favorite techniques for fear-free handling of pets, whether for nail trims, blood draws, vaccines, overall visit experience, etc. I am currently a veterinary assistant at a clinic that is fear-free first, but when it comes down to the care and needs of the animal, we'll just get in there as fast and safe as we can to get the job done. Looking for new ideas to be more successful with the fear-free method. Keep being possum.
That's so cute.
From
oh,
there.
that's totally a
Possum.
Devin thing. Yes, possum.
From
there, did
Sarah,
they
when
say
it
that?
works.
Oh my god, I was gonna say there are some things that have
that's
really
true.
revolutionized
Yes,
our work.
Vocera.
Our work.
I didn't even think about
when
that.
it works.
I didn't either.
Yes, Vocera is definitely one of them.
Sponsor us.
Yep.
Curbside.
Were we supposed to say that? No, not yet.
We'll say
Curbside
what?
stuff.
What'd you say?
Curbside.
Oh, how we did curbside tech appointments now?
Yeah. Because
Yeah,
we carried
kept
that over from
Mhm.
COVID because the clinic was closed to the outside world.
Yeah.
And so we kept discharges, drop offs, tech appointments. Nobody comes in, they just pull around to the back And I feel like it makes everything go smoother. And there's not dogs in the front lobbies screaming at each other. Owners aren't stressed.
It seems like a very
drop and go
small, quiet clinic. And when you come in the front door,
and then people are
no
like,
one
I
would
didn't
have any
realize your
idea
clinic
how
was
much
this
busy
big.
we are.
Yeah.
I also feel like us having the like veterinary assistant and then technician and then doctor teams helps tremendously.
That's a
'cause
great
lot of
organization
clinics
tool.
have, like the tech and the
Yeah.
doctor.
Yeah.
And it's a
Continuity of care.
mess.
Yeah.
We were just talking about that the other day, Amber and I, because like before we did that, when we had 3 or 4 doctors or whatever,
It was
in the
just
mornings we
called
would all the techs,
technician.
Yeah.
we'd gather on a computer, say, okay, you get this drop off, I'll get this drop. Like
Yeah.
that's just crazy that we used
And
to
now
do it
it's
like
so
that.
organized. Like we work with
Yeah.
the same people, we see the same people.
Clients know the same people.
Clients know who to ask for when
You
they
can
call.
form the relationships.
Yeah, that's a
Um,
nice tool.
For me personally, I used to do it regularly, but not so much anymore. But I would write down all the appointments at the beginning of the day and any of their pop-ups on a piece of paper. Sure, the schedule would change, but then when that patient got there, I could just glance at my piece of paper and see like what triggers them or what you can't do on them instead of having to go to their account and looking into that. And it helped me a lot. Go faster.
Yeah.
It was
would
nice
agree.
having that information right there.
Mm-hmm. I like this. I love the sling when
Oh, for fear free.
Yes, for
I was going to say the
fear-free.
sling for me too is one of
Yeah.
the big ones.
I think, I mean, granted, there's so many patients who don't do well. As soon as you get them in the air, they, try to roll an alligator and you're just like, okay, not a good option, but
It's a
I
great
would say at least
option.
65 to 70%. It's a really good option for
Mm-hmm.
pets who don't like restraining or anything like that.
Yeah.
Yeah, and I would say the cozy cat wrap is the other one
It's
for
amazing.
cats.
We'll harp on this again.
For
Yeah.
fear,
So
for fear,
amazing.
just
Not
for the
sponsored.
handling. Not sponsored,
Gosh,
but
I
hey,
wanna be-
Didn't Dr.
I kinda wanna be wrapped in
McCauley
one of
say
those.
that the sling is not fear
well,
free?
that's what she said.
Yeah.
But then I went back and asked Ham, and I was like, "Is the sling not considered free or free?" And she was like, "No, it is." And I was like, "Oh, okay. Well, I don't know. I thought we might have gotten it wrong.
Is
Sure.
Ham fear
That-
free certified?
I don't know. I just went to her and asked her because she said, I don't know. There's some reason why I thought she
I
knew
feel like we
about
should
stuff.
look it up.
Whether or not it's fear free.
Yeah.
Okay. Well, then we
Well,
should.
it's a great tool. And
Yeah,
I do think
regardless.
it does lessen the fear.
I think it, to Macaulay's point, it was like you're just holding an animal. You know what I'm
Yeah.
saying? It's like holding an animal, like when you hold an animal to do a nail trim, like a Pomeranian or whatever, and you're holding them up.
Yeah.
Why are you laughing? Because you're imagining a Pomeranian's not
I
going to let
just
you
think
hold
it's
them
weird that you used a Pomeranian as an example.
Because they're little dogs who don't like anything done to them.
up. I just came up with Pomeranian. I don't know. Just popped into my.
Cute. I think another thing, I don't know if people do this regular, or I think it's a known thing in vet med, but using cones instead of e-collars, or what?
Muzzle.
Using e-collars instead of muzzles.
Yeah.
I
I
think
was
that
actually
works
thinking
really
that
well.
Oh, good idea, Courtney. That's a
We
good
use
idea.
it. Duck
You
and
don't
I
have
do
to
it
get
a
as
lot.
close to their
Yeah.
face.
Yeah,
Yeah,
I
because
love
you don't
that a
have
lot.
to like put something on. Because I feel like sometimes on their face, it's better when they can't see. And if they don't like a towel over their head or something, I think it works great.
Yeah.
And then you just pop it off.
Let's see here. What else? What other organization or tools or products, methods?
We have some people that have little satchels around their waist that
Yeah.
have like their go-to supplies, so they don't
Like a
have to go
fanny
find
pack.
their things.
And
when they-
notepads. People write stuff down all the time.
I always have a
Oh, all
notepad
the
on
time.
me.
A notepad so that you can
Mhm,
remember.
Yeah, that's a
whatever's-
good one because this person is a veterinary assistant. So
Mhm.
that might be a good
A satchel.
tool.
A vet med satchel.
Yeah.
a notebook satchel.
And then depending on how your clinic's set up and like how you guys do appointments, kind of like what Courtney was mentioning before, like looking at the schedule ahead of time so that you're not reacting, you're proactive to the schedule. So you already know what's happening, so you can organize in such a way that it could make you successful, so that when you do get smacked with something like an emergency, it doesn't feel like.
You have nothing. You don't have any of your ducks in a row.
So like one of the things we used to do, and you probably do on some days, is put an appointment here, and here.
Oh, yeah.
So like on the schedule, the doctors will look ahead and go, okay, we're already full. I know somebody's going to call. It's 10 a.m. Somebody's going to call and need to come in. So if that happens, this is where I want you to put them. I want you to put them here, 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 and here. So now reception doesn't have to ask.
Yeah.
They already
Skips
know
the
where to
step.
dump them. So now we've saved time from that perspective.
Yeah.
I think is also.
To Devin's point too about like looking, or like what you're saying, look ahead at the schedule. Another helpful thing that I've been doing, I think almost all the techs are doing it now. We look at our schedule in the morning, like for like our appointments that aren't seeing a doctor or drop offs or whatever. I also think drop offs is a really good tool. I don't know if everybody does it, but drop offs are great.
That's what we prefer.
But you look at your schedule, and then I will set my patient's cage up. So like if it's a drop off, I put a blanket in there, I print their cage card, I print their check-in sheet, and I write down what they're coming in for, and I organize myself like bright and early in the morning before any appointments come in. So then when the patient does get there, if I'm busy or I'm with another patient or blah blah, I can just say, go run and get this patient, throw them in that cage, because it's already labeled. So then you're not frantically running around trying to get a blanket, trying to print their cage card, because then cage cards get forgotten. And I think that's just being like on top of it in the morning if you're able to.
It is a good feeling.
I think the other thing we try and do with drop-offs, and correct me if I'm wrong, but like you guys get the history and everything ahead of time.
Yes.
So that when they call in to schedule that appointment and it turns into a drop-off, somebody's talking to that client then, so that your kennel assistant could run and get the patient, or so there isn't that time suck when the patient's getting dropped off, which I think is really helpful too.
Yep.
So
it's very
that's
helpful.
another way to improve efficiency.
Yeah. It's efficient for the owners too, because they typically got to get to work or go pick someone up.
Drop and go.
The one
Don't have to
thing
repeat
like
things.
that makes it smoother, easier. I don't know why this popped into my head when I read that sentence, but the one thing that popped into my head was doing endotracheal tubes for cats on cats seems to be a place where it's difficult because they have those laryngeal spasms, and so then the larynx slams shut and it's hard to shove the endotracheal tube in. So using lidocaine. But I was taught, I don't remember where we picked this up, but I use a polypropylene catheter, and anytime I'm doing a cat endotracheal tube, and I have it out about this far out of the bottom of the endotracheal tube, because it'll slide through the slam, because it looks like this and you have that small opening down there. It'll go through there, and so it's kind of like just a pass through. And so I'm not talking about extending it out 6 inches. I'm talking about an inch where you can feed that through the larynx first and then slide your endotracheal tube over the top. Works every time.
I've never done that before.
I'm not able to
I've never done that. You just use like the guide wire or whatever we have to like make it more rigid.
But the guide wire, right, it only makes it rigid. It doesn't come out the bottom of the endotracheal tube.
No.
And again, I'm not talking about like, because we don't want to tear the trachea, obviously, with something. But the polypropylene catheters also are less rigid
They're very flimsy,
So, if you come into contact with a wall, you're not, unless you're just being like, you're not going to tear anything. So anyway, that's
smart.
That's my one tip for
I think we could make a whole
cats.
episode about this.
I know.
Question.
I know, it's a great question.
Tips and tricks.
Tips and tricks.
Tips and tricks with the Bert.
With the Bert. Okay.
Oh, it's my spiel.
It is your spiel.
Your spiel.
Text messaging service, text message feature. I need to stop saying service. I don't like that word. Feature. At the top of all the episodes, you can click the little link that says send us a text message. You click that, and then you can type us a question, comment, concern, and leave your name if you'd like a shout out. It's a cool, helpful tool.
That's right.
Now let's hear a word from our sponsor.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicatRioDVM.com for full prescribing information.
Oh my gosh. Okay, before I forget, I want to tell you guys, I know that we had Brian from Brian's Bandages on one of our podcasts.
It was like over a year
Oh,
ago.
it was a little while ago because we were in the other
I was
space.
pregnant.
Oh my gosh, are you serious?
I'm pretty sure I was
I
pregnant.
don't remember it either.
Where did time
Or maybe
go?
I just got back.
Okay,
I
well,
don't remember, but I
anyway,
don't think we were on the
it's
podcast.
really clever. It's really cool stuff. And so he sent me some. I bought some of his things and sent them. And then I'm going to send them back to the clinic so that we can play around with them.
Yeah.
But there are all these cool like themes
I
that
know
you
what
can
these
put
are.
on your vet wrap bandages. So they can be on catheter wraps
I
or they can be
I
on
wanna see
soft
some of
padded
them.
bandages. And I'm like totally a geek for this kind of stuff. So
Dang
All
it,
right.
we have a
Look.
little puppy needed them right now.
look at this.
Finn.
Ah, yeah.
It's like if you had like
Is there a shark?
like Mater, could you imagine Ham's dog Mater and
Yeah.
you put like a lightning bolt on his like bandage? So I mean there's everything from
Mater does want a bandage.
look at these are so
No.
cute.
Oh, yeah. No, she's just saying
Look at
that's his
this
name.
bow tie.
Can I see?
It's so cute.
Wait, so they just like adhere on?
Yeah, it's just you stick it on there. It's just vet wrap. Like it's just straight up vet wrap.
Yeah, and so you just and I think you would really be able to reuse them
Yeah.
if you were changing out the catheter,
Yeah,
short of it
absolutely.
getting like, peed on or
Oh, so cute.
isn't that cute?
That's such a smart business.
I mean, look at this one. This one's
Allie
like
was wanting to make a shark for Finn.
Guys, look at this.
She didn't.
That's so pretty. What the heck?
I know, right?
I want to know what tools he uses.
Yeah.
I know, it's
Does he
really
use, like, a
cool.
blade?
Probably
Yeah.
a little X-Acto knife.
Yeah.
Oh, X-Acto knife. You're right.
That's one's really cute.
I mean,
Wow.
they're just so clever. Anyway, I just
They're
wanted to
cute.
Those are cute.
shout him out. Go
Shout
go
it
check
out.
him out.
Shout
go check them out.
Brian's Bandages.
Smiley
He's got some
face.
Where
nice
can
colors.
they find them?
So, anyway, yeah, go check them out
Where
Yeah.
can they find
Yeah.
them?
at briansbandages.com.
There you go.
So be on the lookout. We might, you guys, if you use these on a patient, you should take a picture and then we
I
can
don't
show
want to
people.
use them. They're too pretty.
I know they are really
I know,
pretty.
right? I
I
just
don't
kind of
want
want
them
to
to
like,
get
Can we stick them on our scrubs
I know.
instead?
Oh, I do have a patient that has
No.
a bandage like right now at work. Like,
you need to pick one and use one.
Yeah.
Are you sending it home with a
Mhm.
band? Oh my God, yes. One.
Oh my god! Take a picture of the take a
I
picture
don't know
of the
which
dog.
Okay.
one.
I'm gonna put these back in the packages while you guys talk about the case.
Okay, case collections.
I'll go first. Mine's like
Okay.
5 seconds.
Okay.
Okay, it's the dog we talked about, cat we talked about a couple podcasts ago that has FIP and went
yeah.
acutely blind.
Yes.
Uh-huh.
It has eyesight again in one of the eyes.
Shut the front door.
And it's still blind in the other one, but not as blind. I forget the percentage. Shoot.
That's blind.
So anyway, the medication is working.
So we went to the ophthalmologist.
It went back for a recheck because we timed it to recheck the corneal ulcer it had at the same time as its retinal detachment. And he has gained sight in one eye.
Go, buddy.
Yay.
This is the one where you were told, no, it doesn't have FIP.
Yes.
No, it had FIP, but I was told by someone else that it probably wasn't that causing the blindness. So, and it was an ophthalmologist.
Solid.
Okay, that's
Anyway,
amazing.
So
Okay,
we
wait,
have
how long are you
improvement.
treating the cat? Tell everybody how long you're going to have to treat the cat.
6 weeks. It was 6 weeks that it was 12 weeks.
12
we
weeks,
talked about
okay.
if you had to break it up. It's 12 weeks total of getting this tablet every day. And we talked about how we were going to come back together, see how he was doing further in the treatment. But really the recent recheck with the ophthalmologist was the key point there because that was his main clinical sign.
So
So,
the
That's
owners
so
got
cool.
the drug.
yeah, they started it and
Okay.
then went and got rechecked. So
Did you get through Stokes?
yes.
Excellent. Excellent.
Solid.
Love
Not the black
Stokes.
market.
Do you expect his
Love
vision to
Stokes.
continue improving?
I don't know if I would at this point because I'm pretty sure there's the response of the drug is 48, 72 hours. You
Gotcha.
start to see. So I think with retinal detachment, there's still a possibility that it could reattach
Yeah.
on the eye that's still blind. I just don't know if I would say, yeah, your cat's going to have full vision back.
Sure.
So
Well, good. At least he can see a little bit.
yeah, I know.
Okay. My case is a 13-and-a-half-year-old Labrador Retriever, female spayed. She presented last week for acute swelling on one side of her face. So she came in. We thought she was going to have like a tooth root abscess or something. And during Dr. Dudley's exam, her head to tail, nose to tail, whatever exam, her thorough exam, she listened to her heart and it sounded so bad. I listened to it and it was just super irregular, super loud. It was rough. So we hooked her up to an ECG, and we were suspicious of some AV block. So we sent the ECG out to the internist to be reviewed. And then their assessment is supraventricular atrial tachyarrhythmia is present. Atrial premature contractions, APCs, are most often associated with atrial enlargement. APCs may also result from mechanical irritation of the atria caused by space-occupying lesions, such as enlarged parahilar lymph nodes, parahilar, heart-based tumor, atrial or auricle mass, or pericardial disease. They can, however, also be seen in cases of wide variations in oh my gosh, these are a lot of words. Autonomic tone, myocarditis, intra-abdominal disease, electrolyte disturbances, or metabolic disorders.
Anything. No, I'm just kidding.
Yes, there's a lot of possibilities there. So they started her on, they discussed like doing a bunch of diagnostics, like an abdominal ultrasound, x-rays, but they did say if the owners declined those, then they could get her started on diltiazem.
Diltiazem.
Oh my gosh.
Diltiazem, yes.
So they started her on diltiazem, and she's due for her recheck ECG tomorrow. So we shall see.
What was
So
wrong with
the
her
face
head?
swelling?
What was wrong with her head?
We did clindamycin and Rimadyl, and
So we assume it's a tooth root.
yes.
and she's
Gotcha.
responding. But that is why it is so important. We have a lot of owners that are like, oh, we think this is wrong with our dog. Can we just get some antibiotic?
Mm-hmm.
But then the dog came in and we worked it up for a pretty severe heart thing.
Yeah.
So that was really good that they came in and we did our thorough exam.
Yeah.
I'm doing
And
a
I feel
full
like-
physical exam.
And we don't, I feel like we don't have much like cardiac stuff like this. At least I haven't
Thank
seen
God.
much.
I know.
God bless the
I feel
USA.
like
No,
maybe
thank
a
you.
little bit more now because we're having the cardiologist come in
That's true.
and doing
Oh,
the
that's true.
echoes and workup and
Mhm.
stuff, which are still interesting. But yeah.
So we
And I'll be honest, like I feel like when I find heart murmurs, the dog is usually older in life,
Yeah.
and a lot of owners just don't really want to pursue a workup.
Yeah.
Is the more common.
it
thing
could
I
be
find.
stressful on the old
Yeah.
kiddos.
Mhm.
And It's she a was lot. 13 and a half.
Yeah.
Huh. Cool. So I guess we don't know the reason, but we hope that she responds to that diltiazem.
A whole another example, I guess I should say, of like one problem bringing in the patient,
Mhm.
and yet you find something
Mhm.
more
Yep.
pressing or problematic. It
Mhm.
happens all the time.
Jeter,
Yeah.
our golden with
Yeah.
the cancer.
Just
Yeah.
doing a full physical exam. I had one dog that I came in for some skin or teeth or something, and it had bruises all over his body.
Yeah.
Oh, yeah.
So it was just. you just
I had
never know.
one for the same thing, was a tooth root abscess, but had a mast cell tumor,
Yeah.
And the one you had an ear infection, and it was lymphoma.
and it was lymphoma. I
Mhm.
forgot about that one.
Wow.
I mean, yeah, talk about like a 180 for the
Uh-huh.
owner. It's
Right.
like,
do you
oh, and yes, your dog does have an ear infection, but
also has
yeah.
cancer?
Yeah, that was
Remember that
rough.
youth
Because it
thing-
was a young dog.
Oh, yeah.
Yeah.
It was like
the
18-month-old,
lymphoma
the
one. Yeah,
big
I
dog.
remember that.
Yeah.
It's crazy. We had a euthanasia scheduled, you and I, like years ago. And it was a new client euthanasia. And then she left with ear meds with the dog.
I remember that. Like you talking about it.
Yeah.
You went in there.
And I think that also
the owner was
it-
very confused, I think. Like it was like a lack of communication or something.
Yeah.
But they left with ear meds.
I think also it's
Wow.
just so pressing, like, to remember that, you know, what the animal is coming in for isn't always, like, to look at the whole animal.
Yes.
Yeah.
Like,
Don't look at just
you
the
can get in a
problem.
hurry.
Assume.
It happens to everyone where you
Mhm.
get in a hurry because you think, oh, it's just an ear infection. Okay, great. And you do your thing.
Yeah.
You know, but it's so easy to miss the other things. And, you know, it's like, this is your opportunity to know nothing else is going on. Like, you
Mhm.
don't want to be the person who misses
Yeah.
Right.
those secondary issues
Right.
that could be more problematic for the patient.
Yep.
Mhm.
So, yeah,
Yep.
don't believe the hype, you know, whatever's written on the description of the appointment. Right? So
Yeah.
That's
Listen
what I
to
always
the
used to tell myself.
history.
Don't believe the hype. Don't believe the hype.
Yeah.
Yeah.
Because, yeah, it's like, it could be something.
And I still always ask, usually for a temperature on my sick patients, even if it's just skin or something, because then
Yeah.
I'm hearing they're lethargic or they're blah, blah, blah. I'm like,
Right.
I need a temperature.
Yeah.
Cover your bases.
Yep. Okay. Listener question. Hi, everyone. I just wanted to say I recently left veterinary medicine for a different field due to burnout and for my mental health. I certainly miss my furry friends, but I know this change will be good for me. Listening to your podcast makes me feel joy and connection to vet med. Thank you for taking the time to further educate owners or even future owners on how the field is changing so rapidly. That being said, I would love to hear more about your thoughts on hyperesthesia. My poor feline babe, Milo, suffers from it and is on gabapentin 50 mg 3 times a day. I've looked at research from Cornell and few other places, but would love to hear your thoughts as well. Much love to you all, Morgan.
Thank you, Morgan, for the question.
Yeah. It's a good question. That would not be something fun to deal with. I wouldn't want to have
No.
to deal with that.
It depends on how
Hyperesthesia.
severe it is. 'Cause I mean, I think
That's
it runs
true.
like the gamut
Yeah.
of like, oh, you know, just by touching the cat, it has, and it doesn't bother the cat as long as you
Right.
don't touch it. To
Right.
Seizures.
yeah,
Yeah.
like, you know, like it, like you know, and then they're like biting everything
Yeah.
and like biting their leg, and
Yeah.
then like,
Yeah.
it's
Yeah.
like crazy.
Where it's like a quality of life thing at that point.
Yeah,
From what I could find online, it looks like there can be like a few underlying reasons, like
Yeah.
allergies or like
Mhm.
some more orthopedic
Pain.
issue.
Yep.
So I'm
Well,
curious
yeah,
what
pain.
all like diagnostics they've done, you know?
Oh, for like this cat in particular. Yeah. I agree.
Yeah.
I think knowing the history, the age of the cat, all of that stuff, I find that I have a hard time convincing the owners there's a component of hyperesthesia if it's very slight.
mm-hmm.
I'm like, does your cat always bend its back like that when I go to pet it? And sometimes they say, no, it doesn't do that to us at home. I'm like, okay, it's just me then. But sometimes they're not convinced it's an issue.
Mm-hmm.
I feel like it's hard to convince.
It's not a
like,
real
well,
thing.
why? And then you're like, well, it could be all these
The
things.
cat's
And-
Well,
just
because
dramatic.
and they don't
Order.
really know the reason. They don't have a cause,
Mhm.
you know. So it's like we know these things can certainly exacerbate it.
Sure.
So if you have fleas or
Mhm.
you have
Allergies.
food allergies, and
Mhm.
cats manifest as skin disease, and so or one of the ways is skin
Yeah.
disease. So or you know like back pain, you know, or
Mhm.
Yeah.
arthritis. But I think. And then, of course, if you have a gazillion different treatment options, that's also a clue that we don't know
Right.
what causes it. I do think a lot of the cats get relief from gabapentin
Mhm.
or amitriptyline or steroids.
Yep.
What else am I missing?
I mean, amitriptyline, isn't that, that's what it's labeled for,
Yeah.
is like wind up pain.
yeah,
which
one
is
of the
a little
things.
different.
Yeah. But
Yeah.
I think now that we have Silencia,
Right.
might be
like
an
a
option if it's
trial
related
or-
to pain, like, you know, like
Arthritis.
arthritic pain.
Right.
Yeah.
It could, you know, maybe make a difference.
Yeah. Rarely do I feel like if it's true hyperesthesia, it's a behavior thing. Now, granted, gabapentin will help with a behavior components ever so slightly because it does relax them, but it's a fine line of when you prescribe it, you don't want to do it too high, so then the cat has bad side effects like that sedation, but you don't want to do subtherapeutic ranges so you don't cover pain control.
Mm-hmm.
Yeah.
It's not an easy thing to diagnose or deal with,
Yeah.
to be honest with you, because not many people want to be like, yeah, let's go x-ray them or
Right.
whatever.
Yeah.
Mm-hmm.
So
Yeah.
I think, yeah, you would pursue a certain number of diagnostics, like in a certain routine or whatever, you
Sure.
know. So obviously your physical exam, you're ruling out flea allergies and whatnot, x-rays,
mm-hmm.
lab work,
Yep.
Mm-hmm.
right?
Yeah.
I mean,
I don't know what else.
food, maybe a food trial.
Something
Yeah.
that I read said like MRI or CT,
Oh,
but I think that's just to look at the nerves.
well, I was gonna say MRI would just to look at the spinal cord
Mhm.
nerves. Like, is there?
Yeah. And then I think it's just a function of addressing, if you do find an underlying cause, addressing that.
Hmm.
If you don't and you have nothing, you know, so you've ruled out everything,
Mhm.
then you are just left trying treatments.
Yep.
Mhm.
So
Mhm.
I hope he's doing well. She doesn't say how he's
Yeah.
doing, but I hope
And
he's doing okay on the
I would be
GABA.
curious to hear what kind of signs she notices at home,
mhm.
to know that it was affecting his
his
quality of
routine,
life.
his like daily
Yeah.
routine.
Give
Yeah.
us some more information, Morgan.
Yeah.
His signalment.
It is something we see. I mean, a lot. I mean, it's not like we never see it.
Right. Oh no, I can think of several cats right now that I've
Yeah.
talked
Really?
to owners about. Mhm.
Hmm.
I
Yeah.
just think that some of owners don't know it's there.
Exactly.
Do you know what I mean? And
There-
I think
I think a lot of people would think that. Sorry to interrupt
No,
you.
you're
Is that
fine.
like it's a cat? It just doesn't want to be touched. It's
Mhm.
like I think that's why it's hard to wrap your brain around the fact that your cat actually has a sensitivity rather than it's just being a cat and it doesn't want to be touched.
well,
right
and
now.
I think they equate it to a dog. Like, so I've often heard in a room, like, oh, it's just like my dog when I scratch the spot and his leg
Right.
goes. And instead, this cat, when you pet it, is jaw chattering.
Mhm.
Like, and it's like, oh no, it's not the same quite. It's not quite the same thing. They're not the same thing. And we don't see we don't see this type of hyperesthetic syndrome in dogs, or it hasn't been documented in dogs. So, you know, if your cat is doing that, if it's jaw chattering, if it's biting its leg when you pet it, what are some other common things that you've seen?
I mean, mine is like the swoop back,
Just
you know,
twitching.
just to pet them. And
Yeah.
they're just like, oh,
Yeah.
like, almost like a shiver down their back. You know,
Mhm.
Yeah.
they're just avoiding it. They don't want it to be.
I think it's out there. People just don't know about
Yeah.
it.
Yeah.
So
Interesting.
it'd be helpful for listeners too, maybe like what signs prompted
Mhm.
it and what you see at home and stuff.
Yeah.
And how it's
Absolutely.
doing on gabapentin.
Yeah.
Hopefully well.
Okay.
Hopefully well.
Thank you, Morgan.
Okay. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Woo!